This is what we're doing. Now, Mr. Speaker, number one is we need a vision. Now, that vision was articulated in the Foundation for Alberta's Health System. It's a comprehensive document developed by experts in healthcare, experts in safety, experts from this province. And this report has been accepted. The number two issue is to actually fund healthcare. We in this province have made a decision to fund healthcare. Number three issue is really how are we going to deliver healthcare? Really, to deliver it, we need to deliver it. I believe we can deliver it efficiently. That's why we went to one region. Healthcare is so super specialized, you simply cannot provide every service in every hospital, every town, let alone every province. There are fantastic ideas that happen in 9 different regions. We're taking the best of the regions to apply those standards province-wide. We go to one electronic health record. Fantastic work was done in Calgary in bone marrow transplants, great work in capital health, in cardiac transplants. We were the model of the healthcare, the electronic health record in the nation. And that record is being standardized. We did Bill 52 last year. We're going to hook all the family doctors' offices, get the records, so we don't have to keep repeating tests all the time. But we must do it by protecting the public's privacy. It was a collaborative decision made by all party committee. I believe we came to reasonable compromises in helping protect privacy while we work on the record. Now, Mr. Speaker, this is really about creating the best performing publicly funded healthcare system, not in this country, I would say in this world. We have an opportunity to have the best publicly funded healthcare system on this planet. For that, I would first start by thanking the member from Calgary West for creating the opportunity, have the political will and the courage to withstand the criticism to allow us to do this by going to one region. And secondly, I'd like to thank the Honourable Member for Edmonton-Rutherford and Ms. Prowse for leading this conversation to bringing out this report. Lastly, I'd like to thank the Premier and the Honourable Minister from Edmonton-Mill Creek for taking this baton forward and working on the funding part. Mr. Speaker, my friends in the country, when I was a representative of the emergency docs, and I still work every Sunday, they used to say, when I used to lecture across the country, we in the other parts of the country have wonderful ideas, but you people in Alberta actually have the courage to do something about it, the political courage to actually do something about it. Mr. Speaker, the nation is watching. I lay a challenge to every health minister in this nation. I lay a challenge to the Prime Minister of this nation to adopt this, to revise the Canada Health Act, stop rationing health care, let's deliver it efficiently, let's deliver it effectively, let's have evidence-based health care, let's concentrate on outcomes. What do we do with the money we spend and what outcome we get? And let's do it together with the people that actually work in the front lines. And let's start by asking Albertans and Canadians what they expect from their healthcare system, what they want, what they expect, how we're going to get there, and we got to get there with them coming out our sides. I lay a challenge to our good friends south of the border to pass that bill. Those 50 million people who are not insured, they're workers. That's going to make the economic productivity of the Liberal workforce even worse. Mr. Speaker, this issue is way beyond healthcare, way beyond proportion of your budget. This issue will affect us economically, has affected us economically, because now the borders have opened up. We have a lot of young people not enough young people coming up. We have a lot of seniors. It's not the seniors alone. It's their kids and their grandkids when they went from active lifestyles to inactive lifestyles. Our childhood obesity rates in this nation have gone the wrong way. The only one thing that's gotten better is smoking rates. We're down to 19% from, I believe, 50 or 40%. When Mr. Marlborough used to smoke, and guess how he died? Lung cancer. All his buddies all have heart disease 15, 20 years before their mother and father should have had it. You know what? Their kids, the grandkids, obesity rates have gone from 20 to 29%. These kids are having diabetes at the age of 10, type 2 diabetes. Mental health rates have gone through the roof. 100% of our kids eat too much salt. They don't move enough. They move less than ever. They eat more than ever and eat the wrong stuff more than ever. Yes, we need more doctors and nurses. Yes, we need to run the system more efficiently. But you know what? We need fewer patients.
Thank you, Honourable Member. But there's an opportunity now for 29-2A. The Honourable Member for Edmonton, Beverly, Clareview.
Yes, I'd like to ask the Honourable Member. You said something that sparked my attention. You said that health is going to be the #1 issue in the world, and here as well. Now, I would think that the economy would be the #1 issue in the world, because if we don't have a healthy economy, how are you going to pay for health and education? Could you answer that for me?
The Honourable Member.
Thank you, Mr. Speaker. I'd like to thank the Honourable Member for that question. In fact, these issues are all intertwined. You're absolutely correct. Jobs are very important. And health is very important. They're all intertwined. Health, education, and economic participation. These are the pillars of every society. When we have jobs, you've got to make sure that our employees are healthy. But you know what? You can have healthy employees, but they have no jobs, then they get unhealthy and they get depressed. So we need it all. So I'd like to thank the Honourable Member, and I'm a doctor, so I'm a little biased. I have to sort of put the health thing a little forward. But you're absolutely correct. Economy is also one of the #1 issues. Thank you.
The Honourable Member for Edmonton-Meadowlark, 29-2A.
Yes, please, Mr. Speaker, and I would like to thank the Honourable Member for his speech. I enjoyed his presentation, and I listened with interest. First off, I would like to request a copy of the document that he was referring to in his speech. I could see the title from here. I'm surprised, but it was a foundation for Alberta's health system. It's a document I'm not familiar with, and I sure would appreciate one. And I believe I'm going to get one, and I would like to say in advance thank you. And I would also like to ask the Honourable Member how he feels the activity-based funding formula that was referred to in question period earlier today will ensure that we do not see any more of the billion-dollar deficits that were recently racked up by Alberta Health Services. How will that exactly work? Thank you.
The Honourable Member.
Mr. Speaker, I'd like to thank you for another opportunity to answer a good question. Really, the activity-based formula, in simplified terms, there's two ways of funding. One is a global budget, which is, here's a lot of money, with no performance and accountability measures. Activity-based is, well, I don't want to use the word fee-for-service. Like as a doctor, I get paid a salary one day, whether I see 0 patients or 100 patients, I get the same salary. Or in another situation, I get paid only if I see patients. If I don't see anyone, I get nothing. Activity-based is really saying, you know what, if you do X amount of operations, you get X amount of funding. If you do an X amount, the more you do, the more you get. It's really about performance and efficiency and outcomes. But it's not just simple activity-based based on how much you do. We have to look at quality as well. Make sure you get high quality and high performance. That's my understanding of activity-based funding. And the real person we really need to ask, the real expert in this, to be honest, is Dr. Deckett, who's the CEO of Alberta Health Services Board. Thank you.
The Honourable Member for Edmonton-Meadowlark.
In the time remaining, quickly, Mr. Speaker, to the Honourable Member, will activity-based system create competition between hospitals within Alberta?
The Honourable Member.
Thank you, Mr. Speaker, and I'd like to thank the Honourable Member for another good question. As I mentioned, healthcare is so super specialized. We simply cannot provide every service in every hospital or every city or every province even. It's really not about competition. It's about how can we get every hospital to perform the best that they possibly can and actually get collaboration between the hospitals. I work at the Royal Alexandra Hospital and the U of A Hospital. There's no competition. If I have a patient that's suffering and they need specialized care at the U of A, my good friends at the U of A help us out. Okay, this is really about delivering good, efficient health care and less about competition. The only competition is how I performed yesterday in my own department. Can I perform better tomorrow in the same department? But if you have two identical hospitals with two identical services, there is that opportunity for them to, I guess, I don't want to use the word compete, I'd rather use the word collaborate. But yes, you can actually assess how one does against the other, and then the one that doesn't do so well, the other hospital can actually coach them and teach them, and we apply these standards. Say, look, this is what we're doing better, and collaboration is a better word. Thank you.